Hi, I'm Dr. Thad Deal, and I'm a board-certified chiropractor. I'm also the clinic director and founder of the Advanced Center for Pain Relief and Wellness here in State College, Pennsylvania. Our office focus is on chronic, difficult-to-treat conditions like dizziness, balance problems, migraine, headaches, fibromyalgia. We also help people suffering from neurodegenerative conditions like MS and Parkinson, as well as children suffering from neurodevelopmental disorders like autism, ADHD, dyslexia. On this video today, however, I want to speak about autistic spectrum disorders, including ADD, ADHD, autism, Asperger's, PDD, and NOS, and talk to you about how we address these children. We address them neurologically and metabolically, and I think that's what makes our program unique is we address the problem from every angle, and that's really what allows us to get such great results. Some programs focus strictly on the neurological aspects, while others focus almost all their efforts on the metabolic factors. We combine the best of both worlds with our autism recovery program. Neurologically, what we're looking at is a child whose brain is out of sync with itself, also referred to as functional disconnection syndrome. 99.9% of these children on the spectrum, including children with ADD, ADHD, autism, Asperger's, PDD, and NOS, have issues with the right frontal lobe function. To understand how this is going to affect your child, we need to look at the functions of the different hemispheres of the brain. If we look at the right hemisphere, we'll see that it functions as the brake pedal of the brain. It's about withdrawal responses. It stops movement, it stops thought. So a child with a right frontal lobe deficit will be impulsive, distractible. It also controls gross motor, posture, big movement, so your child may be somewhat clumsy. It likes low frequency stimulation like nature sounds, so step outside, that's low frequency stimulation. It's the where part of the brain. It's where social learning and how to apply knowledge occurs. It's non-linear or the creative part of the brain. That's not to say you can't be left brain and not be creative, that's not what we're talking about here. It's where nonverbal communication, in other words, recognition of face, eyes, and body language. It's stimulated by something novel or a new stimuli, and it's about reading, math comprehension. So your child may be very gifted with their times tables, yet when given a word problem, struggle. And it's considered the sad part of the brain. In contrast, if we look at the left hemisphere, this is the gas pedal. It's about approach responses. It initiates movement, it initiates thought, and it controls fine motor, like video games. It likes high frequency stimulation, like TV, video games. So we need to put your child on an electronics-free diet so as not to further accentuate this already dominant left hemisphere. It's the what part of the brain. It's responsible for the memorization of facts. So oftentimes these children can read something one time and recite it verbatim to you. It's linear, it's concerned with verbal fluency, and it likes routines or sameness, and it's considered the happy part of the brain. So what does this look like in your child with a dominant left hemisphere and a weak right hemisphere? What we see is a child that likes TVs, videos, computer. It likes sameness, routines, or rituals, and will oftentimes become very upset if these are interrupted. Oftentimes they'll have a great memory, normal to above average intelligence, but they'll have poor social skills, and they'll often throw tantrums or lack proper emotional control. They're very self-directed, not very passive at all, and they tend to fidget. They will fixate on things or perseverate. It could be anything. It could be, I had one child, it was on garbage. He was fixated or spent a lot of time perseverating on it. And oftentimes they have other sensory issues. If the left side of the brain is about verbal fluency, people want to know why the delays in language. And that's because the ability to speak is dependent on nonverbal communication, that foundational aspect. If you're unable to read people's body language, their facial expressions, if you're unable to know yourself, you're unable to develop proper language skills. So oftentimes by balancing out this right hemisphere, the child's speech therapy can become all that more effective. Also, there are other sensory issues involved because this child is disconnected from itself, from him or herself. We can correct this imbalance by taking away things that accentuate or stimulate this left hemisphere, but also through specific therapies that help to balance out this right hemisphere based off of a very thorough neurological evaluation. We can use things like spin therapy, olfactory stimulation, visual stimulation, auditory stimulation, cross crawl exercises, balance, core stability, you name it. But the thing is, we want to be very specific because each child is different and the areas of the brain affected as well as the severity are different. We also need to look at all the metabolic factors that could be contributing to your child's developmental delays or prevent them from getting better. Things like allergies, also food sensitivities, things like gluten, casein, soy are three of the big ones. There's two problems that you can have with these three foods. The first is an inflammatory or an immune system problem. Your body is attacking these proteins in these foods when you eat them and causing inflammation in your brain and throughout the rest of the body. The second is an opiate problem. Some children lack an enzyme necessary to break down gluten, casein, and soy, and they're broke down incompletely into opiate compounds, gliadomorphine or gluteomorphine, soyomorphine, and caseomorphine. And these do just what they sound. They attach to opioid receptors in your brain, so it's like taking a little bit of heroin throughout the day. So you can imagine what that would do to your behavior and your ability to learn. So if these are going on, we need to address them by making necessary dietary changes, and the only way to know whether this is occurring is to test for them. We want to look at your child's immune system. Oftentimes these children have immune dysregulation. However, there's a huge subpopulation of these kids who are autoimmune, and there's issues with autoimmunity throughout the family. Things like thyroid, autoimmune thyroid or Hashimoto's thyroid, rheumatoid arthritis, MS, lupus, Sjogren's, any of those things. If this is the case, managing your child's immune system becomes paramount. There are two parts of your immune system. There's Th1 and Th2. Th1 is the army that attacks and cleans up afterwards, whereas Th2 is responsible for making antibodies that target or that label things for attack and destruction. Normally, there should be some balance between the two. In a healthy individual, that's what we see. However, in an autoimmune situation, one side can become dominant and the other suppressed. So we want to support your child's immune system appropriately and bring that immune system back into balance. We also need to find out whether there are any underlying triggers to this immune attack. Things like underlying infections, bacteria, parasites, yeast, heavy metals, blood sugar dysregulation, hormone imbalances, and the only way to know whether this is happening is through specific testing. We also want to look for healthy gut function. We can do so with something called a stool ecology profile that allows us to look at bacterial levels in your child's gut. There should be healthy bacteria in your gut. The problem, many of these children have been on numerous courses of antibiotics for repeated ear infections. And what that does is it's non-discriminative in the bacteria that it kills off. So it kills off the good bacteria as well as the bad bacteria. Normally in a healthy gut, the good bacteria live in harmony with yeast. When you kill off the good bacteria, the yeast is allowed to proliferate. So many of these children have problems with yeast overgrowth, or dysbiosis it's called. And what this does is it damages the integrity of the gut lining and creates a situation called leaky gut syndrome, in which large proteins are leaked into the bloodstream and initiate an immune response. Some signs that your child suffers from a yeast problem are dark circles under the eyes, or oftentimes referred to as allergic shiners. They may press on their stomach or lean over the couch. And interesting enough, sometimes these children will giggle at nighttime. So we can check for that and then heal their gut through appropriate nutritional and dietary supplementation. Last but not least, we need to check for toxins to things like heavy metals, mercury, lead, and address those as appropriately. By doing all this testing, we know exactly how to address your child's individual causes. You see, there is no one cause, there is no one cure. So we need to be very specific and treat your child as an individual. Our philosophy is we fix the person and not their diagnosis. Based off all this testing that we do, we can provide you with a specific program of brain-based therapies to address this functional disconnection syndrome, as well as specific dietary, lifestyle, and supplementation based off the specialized testing that we do. This will take a lot of commitment on the family's part, really. It will require lifestyle changes, as you may need to remove some things from your child's life, as well as make necessary dietary modifications. It will also require you to work with your child for 30 to 45 minutes a day, 3 to 4 days a week minimum, on these brain-based therapies that we'll provide you with to do at home as well as in the office. So we're looking for parents who are willing to do whatever it takes to help their child get better. But if you do what we're telling you to do, we're giving you the opportunity to help change your child's life. If you would like to discover more about our autistic spectrum disorders recovery program, or you would like to schedule a consultation for yourself and your child, please call our office or request more information, and you can be our guest at an upcoming childhood developmental disorder workshop.